What are the treatment options for overactive bladder? Overactive bladder is a condition that many people experience, and it can really affect daily life. It causes a sudden, strong urge to urinate, which may lead to frequent trips to the bathroom, involuntary leakage, and waking up at night to urinate. While it is different from bladder cancer, both conditions share some bladder health concerns. Understanding how to treat overactive bladder is important for overall well-being. The treatment for overactive bladder typically follows a stepwise approach. This means starting with the least invasive options and moving to more advanced therapies if necessary. This method is supported by major medical organizations and aligns with current scientific guidelines. The first step usually involves making some lifestyle and behavioral changes. Bladder training can be very helpful. This involves gradually increasing the time between bathroom visits to help your bladder hold more urine. Pelvic floor exercises, often known as Kegel exercises, can strengthen the muscles that control urination. Dietary modifications can also make a difference, such as reducing caffeine, alcohol, and acidic foods that might irritate the bladder. Additionally, managing fluid intake by adjusting the amount and timing of what you drink can help avoid overfilling the bladder. If these lifestyle changes do not provide enough relief, the next step may include medications. Commonly prescribed drugs for overactive bladder include anticholinergics, which help relax the bladder muscle and reduce urgency and frequency. Another option is beta-3 agonists, which activate receptors in the bladder to help increase its storage capacity. These medications can be effective but may have side effects, so it is important to use them under the guidance of a healthcare provider. For those who do not respond to medications or cannot tolerate their side effects, there are more advanced therapies available. Sacral neuromodulation involves implanting a device that sends mild electrical impulses to the sacral nerves, which help control bladder function. Percutaneous tibial nerve stimulation is another option, where a thin needle is inserted near the ankle to deliver electrical stimulation to nerves affecting bladder control. Botulinum toxin injections into the bladder muscle can also help reduce overactivity and improve symptoms. In cases where other treatments have failed, surgical options may be considered. These procedures might include bladder augmentation, which increases the size of the bladder to improve its storage capacity, or urinary diversion, which redirects urine flow away from the bladder in severe cases. It is essential to remember that while overactive bladder is not the same as bladder cancer, maintaining bladder health is important for both conditions. Symptoms like urgency and frequency can overlap, but the underlying causes and treatments are different. For bladder cancer, treatment usually focuses on removing or destroying cancer cells and may involve surgery, chemotherapy, immunotherapy, or radiation therapy. If you are dealing with overactive bladder or have concerns about your bladder health, consulting a healthcare professional for a personalized treatment plan is crucial. Treatment should be tailored to your symptoms, medical history, and preferences. Regular follow-up and open communication with your healthcare provider are key to successful management. In summary, treatment options for overactive bladder range from lifestyle changes and medications to advanced therapies and, in rare cases, surgery. Prioritizing bladder health through evidence-based care and regular medical supervision is essential for managing this condition effectively.